Okay, so today we're going to be talking about the anatomical features of the cricoid cartilage, which is part of the larynx and part of the laryngeal cartilage. We're going to also be talking about the muscles and actions found in the larynx. And lastly, we're going to be talking about motor and sensory innervation of the larynx. So we're going to start off quickly describing the anatomical features of the cricoid cartilage. So as I said earlier, it is the first. It is one of the laryngeal cartilage. It's actually the most inferior, so the lowest one. It's the most inferior laryngeal cartilage, and to be exact, it's actually found below the thyroid cartilage, around the vertebral level of the C6, and it actually completely encircles the airway. In terms of its shape, it's got a broad lamina posteriorly and a narrow arch anteriorly. And the posterior surface itself has two shallow oval depressions, which are actually separated by like a vertical ridge, which serves as the attachment for the esophagus. As we continue to talk about the laryngeal cartilage, it also has an arch and an articular facet for the arytenoid cartilage, as well as an articular facet for the thyroid cartilage. So the two articular facets are essentially found on each side. And to be more specific, the superolateral surface is the site of articulation with the base of the arytenoid cartilage, whereas the lateral surface is the site for the articulation with the medial surface of the inferior horn of the thyroid cartilage. So that kind of covers the cricoid. Now we're going to move over and talk about the anatomical features, of the muscles and the actions that they perform within the larynx. So the first muscle is going to be our extrinsic muscles of the larynx, and they essentially have one remote attachment and one attachment into the larynx or the hyoid bone. It's usually the extrinsic muscles are able to move the larynx up or down, and this is because we have suprahyoid muscles, which are going to pull the hyoid bone and the larynx upward. And then we have our infrahyoid muscles, which are going to pull the hyoid bone and larynx downward. Then we have our intrinsic muscles, and there's many. So just to be very quickly, the ones that we have are the cricothyroid, the posterior cricoarytenoid, the lateral cricoarytenoid, the oblique arytenoid, the transverse arytenoid, and the thyroarytenoid, as well as the vocalis muscle. So in terms of their function, the cricothyroid is actually fan-shaped, and its origin is going to be the anterior lateral surface of the arch of the cricoid cartilage, and it's going to expand superiorly and posteriorly to attach to the thyroid cartilage. And each muscle has an oblique and a straight part, so that's important to mention. The cricothyroid, actually, the oblique part is going to insert into the inferior horn of the thyroid cartilage, whereas the straight part inserts into the inferior margin of the thyroid cartilage. And the action is going to be, as I said before, is to move the cricothyroid joints, which are going to result in pulling the thyroid cartilage forward and rotating it down relative to the cricoid cartilage. And this is going to allow for stretching and tensing of the vocal ligament. And it is innervated by the external laryngeal nerve, which is part of the vagus nerve. The next intrinsic muscle we're going to talk about is actually the posterior cricoarytenoid. Its origin is located on the posterior surface of the lamina of the cricoid cartilage, and it's going to insert into the muscular process of the arytenoid cartilage in the posterior aspect. Now, the actual action it performs is going to be to externally rotate the arytenoid cartilage, or if we want to be more correct in our terminology, it's actually going to abduct the arytenoid cartilage, and it's the primary abductor of the vocal cords, and it's also going to open the rima glottitis. So it's innervated as well by the recurrent laryngeal nerve, which is also part of the branch of the vagus nerve. And then we have our lateral cricoarytenoid intrinsic muscle. The origin of this muscle is going to be the upper surface of the arch of the cricoid cartilage, and it's going to insert into the muscular process of the arytenoid cartilage on the anterior surface this time, instead of the posterior. And the action is going to be to internally rotate the arytenoid cartilage, and it results in adduction, so adducted or closed vocal cords or vocal folds, and also being innervated by the recurrent laryngeal nerve branch of the vagus nerve. The next intrinsic muscle we're going to talk about is the transverse arytenoid. The single muscle spans between the lateral margins of the arytenoid cartilages, with the origin being the lateral border of the posterior surface of the arytenoid cartilage, and it inserts into the lateral border of the posterior surface of the opposite arytenoid cartilage. The action of this muscle is going to be to adduct the arytenoid cartilage, so it's going to result in closure of the rima glottitis. This muscle is also going to be innervated by our recurrent laryngeal nerve, which is a branch of the cranial nerve 10 or the vagus nerve. Then we have our oblique arytenoid, which is another one of the intrinsic muscles. Its origin is found on the posterior surface of the muscular process of one of the arytenoid cartilages, and it's going to insert into the posterior surface of the apex of the opposite arytenoid cartilage, with some fibers continuing laterally around the margin of the arytenoid and actually inserting into the aryepiglottic fold. The oblique arytenoid is going to have extensions of the muscle fibers into the epiglottis, and the action is going to be to actually narrow the laryngeal inlet by constricting the distance between the arytenoid cartilage and the epiglottis. It results in adduction of the arytenoid cartilages and therefore closes the rima glottitis, and it's also innervated just like the other muscles by the recurrent laryngeal nerve. Last, we have our vocalis, the last of the intrinsic muscles, and it's found lateral and parallel to each vocal ligament. So it actually originates on the lateral surface of the vocal process and the anterolateral surface of the arytenoid cartilage, inserting along the length of the ipsilateral vocal ligament. So the action is going to be actually to adjust the tension of the vocal folds, and this is also going to be innervated by the recurrent laryngeal nerve. Then we have our thyroarytenoid intrinsic muscle. Its origin is on the lower half of the thyroid angle, and it's also its other part of the origin is actually adjacent to the external surface of the cricothyroid ligament, and it's going to insert on the anterior lateral surface of the arytenoid cartilage, performing the action of relaxing the vocal ligament through narrowing the laryngeal inlet. And again, this muscle is also innervated by the recurrent laryngeal nerve. So this leads us to the innervation of each nerve. So we have sensory and motor innervation, and it's done by two branches of the vagus nerve. It's going to be done by the superior laryngeal nerve or the recurrent laryngeal nerve. So the superior laryngeal nerve actually originates in the inferior vagal ganglion of the neck, and it divides into the internal branch, which is mainly sensory, and also penetrates the thyrohyoid membrane as it supplies the laryngeal cavity up to the vocal folds. And then we have the other branch of the superior laryngeal nerve, which is the external branch. And this one is it has a motor function, and it's going to supply the cricothyroid muscle. Then we have our recurrent laryngeal nerve, and on the left it originates into the thorax, whereas on the right it originates into the root of the neck, and both of them are going to ascend between the esophagus and the trachea and enter the larynx deep to the inferior constrictor muscle. They're going to serve as sensory innervation to the laryngeal cavity below the level of the vocal folds, and it's going to also serve as a motor innervation to all the intrinsic muscles except for the cricothyroid muscle. And just to kind of quickly summarize, the superior laryngeal nerve divides into the internal laryngeal nerve and the external laryngeal nerve, where with the internal laryngeal nerve acting as sensory to the mucosa superior to the vocal folds, and our external laryngeal nerve it descends and pierces the cricothyroid itself, the muscle itself, providing motor nerve innervation to the cricothyroid muscle. Then we have our recurrent laryngeal nerve, which supplies the intrinsic laryngeal muscle, and then we have